In this morning's Business Insight, a plan is in the works that could put UC Health in the national spotlight. Millions of dollars in donations will be sought from the local community to pursue National Cancer Institute designation for the Cincinnati Cancer Center. That designation would help build world-class facilities and hire more top-level scientists to conduct research, as well as doctors to treat patients. Such designation would also likely lead to greater federal funding and access to resources, including clinical trials of experimental treatments. Dr. Rick Lofgren, President and CEO of UC Health, which includes UC Medical Center, the 800 physicians of the UC College of Medicine's faculty practice plan, the UC Health Westchester campus, and the Daniel Drake Center for Post-Acute Care, says the value of NCI cancer designation cannot be underestimated. He joins Business Courier reporter Barrett Brunsman in the studio with more on the request and what it means. Gentlemen.
Thank you so much for joining us today, Dr. Lofgren.
Well, thank you for having me.
Appreciate it. You've got some big news here to share with us. The Cincinnati Cancer Center, which includes UC Health, is going to seek National Cancer Institute designation. How soon do you think that might be acquired, and what kind of investment would it entail?
We hope to acquire the designation as a National Cancer Institute within 5 years. That's a very aggressive timeline and almost unheard of as various institutions pursue this kind of designation. However, we think it's very realistic. Why? Because of the great foundation we have. The faculty at the University of Cincinnati, working in the College of Medicine and Nursing and Pharmacy, and in the Children's Hospital as well as UC Health, really have a renowned and internationally acclaimed cancer clinicians, scientists, and basic scientists, and really forms a great foundation. However, it is going to require additional investment, and a considerable investment, probably north of $100 million when it's all said and done. Because we really need to recruit yet another critical mass of outstanding clinicians and scientists to really allow us to obtain this designation.
So, who would you approach for help with this? Would this be the community at large, philanthropic organizations?
Yes.
Yes.
So I think it's really going to require an effort of the entire community to get behind this, because this is going to be a tremendous resource for the entire community and all of greater Cincinnati. So we're going to be looking internally, we're going to be looking for public support, we're going to look to the business community and the philanthropic community to really get behind this effort and what it can do for and transform Cincinnati.
You mentioned you've already got more than 800 doctors on staff at UC Health. What kind of new talent might this attract if you get this designation, or do you need to start hiring ahead of time to help you reach the designation?
So it's going to be building it. We need to have to prime the pump, if you will. We need that next critical mass of scientists and outstanding clinicians, and which will allow us to get the designation. Once you get the designation, you'll attract outstanding researchers from all over the country, which will then attract outstanding clinicians, because really outstanding people like to work together, so it'll just spiral upwards and really be a tremendous asset.
And can you tell me, what might this mean for cancer patients in Cincinnati?
This is going to have a tremendous impact on Cincinnati and really be a resource on multiple levels. For the patient themselves, we're really going to be able to bring world-class programs, the latest technologies, the latest therapies to greater Cincinnati. We're going to be able to bring investigators in that research backbone that's really going to drive that kind of innovation. With that kind of innovation, we're going to have new companies and new products that are going to come out of Cincinnati, which will attract investors and other startup companies to the region as well. It will impact the community in terms of both patient care, research, innovation, and bringing the best talent to this community and really sharing what's wonderful about Cincinnati.
Thanks so much for joining us today, Rick. Peg, back to you.
And thanks.
All right, an ambitious goal. Thanks, gentlemen.